Hello friends, today I want to talk about depression, a disease that I experienced in my youth and struggled with for 3 years. I also had many clients who struggled with depression. But what distinguishes my channel from other channels and psychology content is that I deal with the subject of psychotherapy based on my own methods and the experiences I have gained over the years. I have done a lot of studies in this field and accompanied many clients. Why is the treatment of depression complicated? Extensive studies have been conducted on depression. But we still need more research to make treatment methods more effective. What I realized during the treatment of depression is that traditional psychotherapy may not always be a complete solution. For this reason, on my channel, I try to offer new perspectives and share my personal findings with you. As I said in previous videos, all mental disorders have their roots in the past and stem from negative or destructive energies. The difference between depression and other disorders is that, in many mental disorders, the person vents negative energy. But a depressed person destroys himself and the world around him by weakening, humiliating, and devaluing himself and the world around him. He tries to prevent further harm to himself. But the truth is that nothing lasting or positive comes from destruction. Challenges of treating depression. It is difficult to work with depressed patients because they may abandon treatment at any moment. They deny hope and the positive aspects of life. They have high resistance to change, and they see getting better as dangerous. A therapist must have great patience and not be influenced by the patient's resistance and negative perspective. Common mistakes in looking at depression. Many of us think that if a person is depressed, they only have that problem. But the truth is, the human personality is an integrated whole. There is a high probability that the person is also damaged in other psychological aspects. These weaknesses facilitate the acceptance of new negative energies and the formation of other disorders. Therefore, the first step in treating depression is to help and reduce the patient's problems so that he has enough energy and time for treatment. The role of family and parents in depression. Therapists often encounter parents who are demeaning and have low self-esteem. These parents have high expectations of their children, belittle their children for not achieving their own goals, blame others for their own failures. When a person is constantly humiliated and their efforts are unsuccessful, they develop learned helplessness. This means that the person comes to believe that any effort is useless. Depression is an unconscious defense mechanism. A depressed person unconsciously uses depression as an escape route. Depression is a form of hiding, escaping from reality and responsibilities. The patient feels that he cannot solve even the smallest problems in life. Two main factors that contribute to depression. 1. Trying without receiving rewards. 2. Constant humiliation. Some parents unconsciously involve their children in depression to keep them dependent on themselves and prevent them from entering the outside world. How to treat depression. 1. Replacing negative energy with positive energy. We must show the patient that there is a more beautiful world. He must understand that life is not about destruction, but about building, growing, and changing. 2. Increasing self-esteem and strengthening positive points. The depressed person should continuously recognize and repeat his positive points. We should constantly remind him of his abilities. 3. Creating an internal reward system. The depressed person should learn to reward himself. This will help him become independent and live for his own satisfaction, not for the approval of others. 4. Patience and giving hope to the patient. Treating depression takes time, and we should not expect rapid progress. We should keep hope alive in the patient without exaggeration and realistically. And don't make the normal and healthy world too idealistic. Changing the worldview of the depressed patient. The main root of depression is seeing the world as worthless. We should show the patient that life is more valuable than just finding meaning in the eyes of others. He should understand that the meaning of life is higher meanings such as learning, experiencing, and growing, instead of seeking weak meanings such as wealth, power, and social status. Conclusion. Depression is self-destruction rather than the destruction of others. Treatment requires patience, understanding, and giving hope to the patient. We must help the person replace negative energy with positive energy. The depressed person's worldview must change and find a higher meaning in life. Thank you for watching this video. If you are satisfied with this content, please subscribe to my channel, Effective Psychotherapy.